Yes, I'm ready. Well, good afternoon, everyone. Thank you for joining us as we celebrate the 20th anniversary in the best pandemic way that we can. I know we had hoped to see lots of people in person, but this is the next best thing in 2022. So I will introduce the TSET Board of Directors Chair, Michelle, and then we'll get on with the program. Michelle Stevens is with us and she will kick things off.
All right, thank you, Julie. Good afternoon, and thank you for joining us as we celebrate 20 years of TSET investing in improving the health of Oklahomans. My name, as Julie said, is Michelle Stevens, and I serve as the chairman for the Oklahoma Tobacco Settlement Endowment Trust, or TSET. It's a 7-member board of directors that makes decisions on how the earnings from the endowment are used. The board is politically diverse, and our members are appointed by 7 different elected officials. It's so great to see so many of you on our Zoom today. There's so many familiar faces that have been instrumental in making and setting the course for TSET. We are excited to celebrate our history, and we're excited to celebrate our accomplishments and to tell you where we're headed. And first, I would like to introduce Drew Edmondson. Edmondson was the Attorney General when Oklahoma was one of 46 states to file a lawsuit against Big Tobacco that eventually led to the Master Settlement Agreement. Edmondson, a native of Muskogee, was also one of 9 attorneys general that helped negotiate the national settlement between the states and Big Tobacco. Drew Edmondson, I'll turn it over to you.
Thank you, Michelle. This happened very early in my tenure. I was elected in '94, and in that campaign year didn't hear anything about tobacco litigation. The big issue in Oklahoma was the death penalty. In '94, however, Mike Moore down in Mississippi filed the first lawsuit against the tobacco industry. When I took office in '95, I started going to AG meetings and learning about this tobacco litigation, what it was and what the possibilities were. And frankly, I was a little skittish at first because at that point in time, the tobacco industry had never lost and had never settled a lawsuit. They had a win record that was unmatched by any industry in America. They won every trial and they did not settle any case. So it looked like a daunting task. But over the next year, I started hearing the evidence that Mississippi and then several other states, Massachusetts and Florida, had joined. And in discovery, they had uncovered tobacco industry documents that said things like our children were replacement market to replace their customers that were dying at the other end. Tobacco industry documents that said cigarettes were merely a nicotine delivery device. That you might say you're smoking for the taste, but you're not. You're smoking for what it does to your central nervous system. It's an addictive product. And as I learned more about what the tobacco industry had been doing over the years, I decided that Oklahoma should join that effort. And in '96, Oklahoma became either the 13th or 14th state to join the tobacco litigation. It was a tough row to hoe from there to the settlement that took place in November 2 years later. I just looked back over what we'd done. We had produced over 17,000 exhibits. We had identified 349 witnesses. We had taken 200 depositions. We had identified 99 million pages of Medicaid data. 531,000 documents had been produced, 45 trial court hearings, and 4 petitions to the state Supreme Court had to be battled before we became ready to try the case. In November of '98, I was one of a number of AGs that went to negotiate the Master Settlement Agreement. At that time, 4 states had settled on the eve of trial. The 5th state, the state of Washington, was in trial while Washington's Governor Christine Gregoire was as Attorney General. was chairing our effort. Oklahoma was to be the 6th state to actually go to trial had those settlement negotiations not been successful. They were successful. In November of 1998, the Master Settlement Agreement was filed in the District Court of Cleveland County. And that raised the question, with a revenue stream coming into the state of Oklahoma, of what we were going to do with the money. And I had seen what had happened in some of the other states that had previously settled, that either taxes were cut or the money was diverted. I thought it was important that the money be spent on public health. So we teamed up with Robert Butkin and prepared a document that created the Tobacco Settlement Endowment Trust, and then worked with legislative leaders to get it on the ballot. Once it got on the ballot, I was fairly confident the people of the state of Oklahoma would pass it, and they did by a rather substantial margin. A 2/3 yes vote was truly beyond a textbook landslide in the state of Oklahoma, and TSET became a reality just 20 years ago. I would next like to introduce a pivotal person in getting that on the ballot and getting it passed, and that is our former Lieutenant Governor, Jerry Askins, who as a member of the legislature was in a leadership position and helped to get this state question on the ballot and create that majority that created this great organization. So that's a little bit of the background. Jerry.
Got to get off mute there first. Thank you, General. And what a delight it is 20 years later to be celebrating something that was incredibly unique to the state of Oklahoma and also to the country at the time that this state question actually passed. As General Edmondson and his colleagues around the country were working toward the settlement in the 1997, I have to think this through, in the 98 session, we got word, or there was a beginning to be a belief that Congress might pass something trying to dictate where any monies were going to be spent if they could. And so we as a state introduced legislation trying to create a trust, statutory. It's not the framework that ended up in 2000, but trying to at least set up something so that Oklahoma could control the dollars that would come to Oklahoma as a result of the effort of Attorney General Edmondson's office and his work. We got the bill passed but the governor vetoed it. So the next year we tried again and the House passed it, but the Senate wouldn't vote on it unless there was a guarantee that the governor would sign. And there was not. There by this time it was 99. The settlement was well on its way being implemented, and we began to see, Oklahoma had so many needs that the opportunity to use a great infusion of cash at the beginning was really, really tempting. But it allowed this delay until 2000 allowed an opportunity to really increase the collaborative advocates that were going to be needed once the decision was made later to have a state question. I spoke at medical associations and banquets around and county and city health department events around the state. And each year we gained additional legislative support. So in the 2000 session, when legislative leaders decided that a joint resolution that would take the trust to a vote of the people and put it in the Constitution, which was different than it started out, we actually had more advocates and a better vote than we had the first time the issue came up. Once it passed, Our statewide elected officials like Drew Edmondson and Robert Butkin as treasurer, who became the state treasurer, was an important component to how the financing and investments were going to go. They could help lead the charge in a statewide effort for 692 to pass. And it's been amazing to me, as I've said to some of you, that those fiscal projections we ran in 2000 and 2001 in trying to anticipate and let people know what we thought the income would be. Here we are now at the end, really, of what those projections were originally run for, and TSET's still going strong and doing good work. I would like to introduce Casey Kilbane. Casey, gosh, she has served on the TSET board, I think pretty much from the beginning until last year. And I think you were even board chair twice, as many times as you've had an opportunity to help lead the vision and TSET's incredible growth over its first 20 years. Casey, will you tell us what you've seen?
There, am I off mute? Okay, thank you, Jerry, appreciate that. As Jerry said, yes, I served on the board since 2002, so it's been, it was a ride, and I've certainly watched the agency and the fund grow. But just briefly, Oklahomans trusted TSET to be good stewards of the MSA payments, to protect and grow the trust for future generations. And I feel that the board has consistently maintained that vision and that promise of maintaining that. It was an honor for me to serve for 19 years on the board. It was just a really exciting time as we just started out early to what it's grown into today, where we really are touching almost every quadrant and every sector of the state with programs. TSET has upheld the people's trust by staying true to our mission. It's been thoughtful and purposeful in how it has chosen to invest in improving health. From direct and practical assistance, people can quit tobacco. We've also expanded to well-researched and professional public education. At the same time, it's been nimble, and we've been adept at responding to changing needs and opportunities that have increased the impact as the endowment itself has grown. Investing in research, using technology to reach youth, developing a podcast, and offering food impact grants to address food insecurities among the pandemic. TSET's goals are lofty, but the work is realistic and effective. The focus on local impact through our Healthy Living Program, Healthy Incentive Grants, these partnerships with other entities, and investing in places where the work can be leveraged means that TSET truly empowers change on multiple levels with real and measurable impact. Some of our major accomplishments, the Oklahoma Tobacco Helpline, TSET's first major program. And through the years, it has been a national leader of all helplines. Our helpline has maintained a 34% quit rate for registrants, which is a significant improvement over the 5% success rate for tobacco users who have quit cold turkey. More than 470,000 people have been served by the Oklahoma Tobacco Helpline since 2003. We've had local impact grants, as I said, our Healthy Living Program, our Healthy Incentive Grants, and our Community of Excellence. These invest in health on a local level to maximize our impact. More than 2,200 tobacco-free and/or wellness policies have been adopted by TSET Healthy Living Program grantees. Statewide policy changes have been a big part of what TSET and our partners have worked for. And one thing we are most excited about always is that all of Oklahoma state properties, including our schools, are 24/7 tobacco-free. Oklahoma also adopted the federal policy to increase the age to purchase tobacco from 18 to 21. TSET's public education campaigns are nationally recognized and award-winning. We support access to quality medicine. TSET has helped place 89 physicians in rural and medically underserved area as part of a partnership with Physician Manpower Training Commission. We've also granted millions to cancer and adult stem cell research. A study conducted by the University of Wisconsin School of Medicine and Public Health and the University of Oklahoma concluded that because of TSET, Oklahoma's smoking rate have dropped 10 times faster than it has in similar states. Smoking prevalence has fallen from 28.6% in 2001 to 19.1% in 2021. As well, cigarette sales have decreased by 1 billion packs since 2001. TSET has led the way from the beginning, not just in Oklahoma, but nationally, starting with being the first and only to establish a constitutionally protected trust and carried through in things like public education, our podcast impacts on rehab centers, our CDC recognition. We continue to serve and work and publish medical papers with cutting edge research. TSET continues to establish itself as a leader in public health. Now I'm thrilled to introduce Sean Pryor. Sean embodies everything that TSET stands for and why we exist. He is going to share a wonderful story of perseverance and how the Oklahoma Tobacco Helpline helped him go tobacco-free. Sean?
Thank you so much. I tell you, I really appreciate being here and being able to talk about this. I guess the story starts back a few years ago. I was in my mid to late 30s, and I didn't have the best diet, doing my thing, and I was about a two pack a day smoker, right? Didn't think much of it. I also dipped. So I would dip and smoke, just living carefree, thought it was gravy. During that time, I ended up having a heart attack. And it's really sobering when you're in your late 30s, mid 30s, and you have a heart attack. And one of the big things after my heart surgery is my doctor told me it was huge, massive, that I quit smoking. And at the time I said, okay. And I cut it down to about a pack, and I felt like that was going to be fine. And, things kept going. I was diagnosed with hypertrophic cardiomyopathy. I had an enlarged heart. Along the way, it took my son, we were sitting in the house, and one day he walked up to me and he said, Dad, I want you to quit smoking. And I said, do you? And he said, yeah. He said, I want you to quit because, he said, I smell like cigarettes and you smell like cigarettes. And he said, more than anything, he said, I don't want to lose you. And it was sobering. It was very difficult for me to look him in the face and think, can I really put a cigarette? Can I really put a dip ahead of my son? And the next time I went to the doctor, obviously I didn't quit for a few days. I told him I would. And I went to the doctor for something, saw the cardiologist, a little follow-up, and he said, I asked him about quitting smoking, and he gave me this card. It was a little placard for the Oklahoma Tobacco Helpline. And I said, what is this? What is this? And he said, you need to call this line. He said, they will help you to quit. And I said, man, and I'm not much for asking for help, By this time, I'd been a firefighter for a couple of years, and I'm a tough guy. I was not the guy to ask for help. So one day, obviously still with what my son said heavy in my mind, I called, and I expected to have somebody on the other end that was going to judge me. And, they were going to give me a speech about why I should quit. It was the exact opposite. I talked to somebody who was very understanding, very helpful, and it got me started down that path. The NRTs got mailed out. Next thing I knew, I had managed to quit, and I apologize. I get a little bit emotional when I talk about this. I had managed to quit. I can tell you that it's been 2022. We're coming up on about 3 years since I've had a cigarette, since I've had a dip, anything. The Oklahoma Tobacco Helpline was beyond instrumental, not just in me quitting, but in me being able to continue to sit here in front of you, smoke-free, dip-free, all of that. And it's been something that I've been able to share with my fellow firefighters. I've been able to share with folks that I work with, everything. It has absolutely changed my life. It has been a blessing. I get years back on my life because of this. And without the help, without the fact that it's so judgment-free, and just without that help, I don't know if I'd be sitting here talking to you. I probably would have had another heart attack. So I can't say thank you enough, and I can't say enough to anybody. Just, Lord, get the help. It's there for you. And just thank you.
Thank you, Sean. Your story is just amazing. And I'm so glad that we have it across the state, that people are hearing that. And I don't know if you see the chat boxes that come up, but all of them are very congratulatory and are very encouraged by your story. And it helps us as we serve on the board to remember why we're here and why we do what we do. So we really appreciate that, Sean. Very, very moving. Well, since the beginning of TSET, our guiding principles have been to fulfill its constitutional mandate to support programs to improve the health and well-being of Oklahomans, just like Sean. In 2020, Oklahoma voters reaffirmed their commitment to that mission and showed overwhelming support for the trust by voting to keep the TSET endowment intact. TSET will honor that trust by remaining true to the mission and nimble as needs do change. Over the next 3 years, TSET directors will focus on rural health, obesity and nutrition, and youth programs as we continue to pursue public health best practices and innovative ideas to make healthy lifestyles accessible to all Oklahomans. We will confront new challenges and new as they arise. And as you all know, vaping has changed the landscape going forward, while the tobacco industry has pulled us back in time by resorting to many of their old tactics. So youth and vaping will be a major focus for us as we proceed. And like the rest of the country, Oklahoma faces rising costs, both monetary costs and human costs associated with the rising rates of obesity. They tell me that today's children may be the first generation in US history to live shorter lives than their parents. We cannot let that happen, and it's so vital that we ensure Oklahomans all have the tools and information they need to help themselves and their families get healthy. TSET will continue food access and equity programs as a way to improve health, and especially among our vulnerable populations, and support programs that encourage and facilitate physical activity. TSET will look for ways to create unsolicited grant opportunities to expand our impact and create new partnerships with Oklahoma's private nonprofit sector. TSET will continue to support policy improvements that would have a significant impact on lowering smoking rates, such as the universal clean air laws. And TSET will continue and build upon our successes in research, continuing to invest in work that brings cutting edge care close to home for all of our Oklahomans. And we will support programs that place doctors in our rural Oklahoma areas where they are desperately needed. Most of all, we will continue to look to the future, and improving the health and changing behaviors is a generational undertaking. It will take all of us. Part of the wisdom of state leaders and voters who created TSET is in creating an agency that is able to look past the next election to the next generation. TSET will continue the work towards healthier Oklahomans for today's children and for their children and their grandchildren. We have a lot left to do. I would also like for you to hear from TSET's executive director, Julie Bisbee. Julie joined TSET in 2012 as our public information officer and has directed the agency now for 3 years. Julie has guided TSET through the ever-changing landscape of the pandemic with grace and boldness and an eye for a consistently look at our future. So Julie, I'll turn it over to you.
Thank you, Michelle. And thank you to our panelists, Drew, Jerry, Sean, Casey, Michelle. We're all part of this. We are part of this effort to create a healthier Oklahoma. And it is exciting to be living out the vision that Drew and Jerry and all of those lawmakers and the public that supported this. We have made this a reality. This year, I celebrated my 10th year at TSET, which is amazing that it's half the time that we've been alive. So that's really fantastic. And I am always inspired when I hear folks talking about what they hoped that they would see and the vision that they had, and how the board has been very steady in fulfilling that and making good decisions, fulfilling the vision of a healthier Oklahoma and the vision that we can change for the better. And that is amazing. And we have seen that progress. So thank you all for being a part of this, grantees, partners, champions. It is no easy feat. Every year, you know that. And we are so proud that you are with us today. We are so proud to be celebrating a 20th anniversary of something I'm sure that when Drew and Jerry were talking about it with Robert Butkin, thought, let's try this. Let's see what happens. And look at us now. Amazing. So thank you all for celebrating with us. Thank you all for, your constant support and diligence. And we would love to take some questions if there are any in chat. I would also direct you to the link that's in chat. That is our annual report released this past month for last fiscal year. You can take a look, see how far we've come, seen some of those annual outcomes as well as those long-term outcomes. So I'll give you guys a minute to put your questions in chat or raise your hand. You've got a great panel of folks here, so please take the opportunity to be curious. This is also my favorite part of every Zoom meeting, where if we were all in a room, we'd all be looking around. All right, Sandy Foster, if we can unmute Sandy, she's got a question.
Hey, thanks so much, Julie. I just want to say, there's so many of my heroes that are sitting right here on this panel. I got to be involved. That was kind of my start in tobacco prevention when all this stuff was going on. So, to Attorney General Edmondson, I still think Jerry Askin should be our governor, should have been our governor, along with Robert Butkin. You guys absolutely are heroes. Casey, you've been there forever. So thank you guys for all you do. I think my question really goes back to every year we fight the legislature. They come after TSET. As you mentioned, we were really successful in letting them know the last time they came after it that, we weren't going to have it, but they're wily. They're very good at finding different ways to get what they want. So I'm curious, do you guys have any feelings about what might be coming? And really more importantly, what can we do besides just staying involved and staying on top of it and letting them know how we feel? What can we do to kind of, I'd like to see this issue go away. I'd like to see them stop trying to take TSET money. So I'll stop there.
Yeah, I would open that up to any of you who've been in that distinguished body. So I think there's only two of you.
Well, I'm reminded of what Katharine Hepburn said to Humphrey Bogart in African Queen. She said, human nature, Mr. Allnut, is what we're placed on earth to rise above. It is very difficult to get the legislature to rise above human nature. Legislators, and I would say governors also, enjoy having money to spend. And if they can get their hands on more money, and I don't say that they would be wasteful, it's just that their priorities might be different than our priorities. I felt strongly when we filed and then settled this lawsuit that it was all about the health of Oklahomans. And that's where at least the lion's share of the money should go. At some point in time, the board of TSET might want to discuss the possibility of taking the bull by the horns and saying, if this is going to get changed eventually, let's try to work out a change that we can live with, that we're in favor of. And, maybe talk about a gradual reduction of the percent over a period of years to where maybe it gets back to the 50-50 that it started out as in the first year of TSET. But that decision, that's why Jerry and I worked so hard to get this into the Constitution. That decision does not belong to the legislature exclusively. That decision belongs to the people of the state of Oklahoma. And before there's any change in that, I think the first voice that should be heard should be the voice of TSET. That, at some point they may say, we believe we've got enough in the endowment that our annual income will be sufficient for the purposes that we want to accomplish. But until that day comes, as long as I have breath, I'll be part of the opposition to the legislature making changes in TSET.
Well, and Julie, if I can, certainly through the years I was on the board, we did address many requests that came our direction. And
Yeah.
I'm always reminded of a little plaque that my mom had on her dressing counter that says, when life gives you lemons, make lemonade. And I feel like there's so many of those times when we sat down and had the conversations that TSET really did turn it around and made some incredible lemonade. We can just point thing after thing that we were able to do that with. What I've seen over the last few years is that we're beginning to find more and more people in the legislature who are talking about TSET in a positive light, and talking about that concept of TSET being the extraordinary, that Oklahomans put us there and entrusted us with this to be able to do the extraordinary things that truly will move the needle in health improvements for Oklahoma. It's prevention. It's looking at those things in those counties and places that our typical tax dollars can't touch. And so I was proud that through the years, we've been able to continue to sing that song and say, let us do those extraordinary things that you can't possibly cover in the legislature and what you do as a government for our state. And I think that we're beginning to hear some of that kind of resonate with some of the folks over on Lincoln. So I'm encouraged by what we've seen over the years. And I think certainly the vote kind of finalized that and kind of cemented that concept, at least for those people who are involved right now. But I think, again, we have always turned it into some pretty amazing programs that we've had when we've had questions from them. And I think that our relationship working with them has improved through the years too.
The absolute critical thing that TSET and the people of the state of Oklahoma need to be wary of is that TSET maintain the income from the trust. That income will continue to grow. Our hope is that the payments from the tobacco companies, and I said this 20 years ago, our hope is that someday they will cease because people aren't smoking anymore. The important thing is to hold on to the income from the corpus of the trust itself.
Jerry, did you have anything to add to that?
In case there are other questions, I'll just ditto what Drew and Casey have said.
Excellent. And I think it's really important to highlight the early work of creating a foundation that has programs based in evidence and science. Our founding executive director, Tracy Strader, was very instrumental in that. I saw Doug Matheny on this call. I know that there were a lot of partners from the State Department of Health that were very instrumental in those early planning years. And because of that foundation, our road is made straighter, right? We can continue some of that great work that those minds put together, and the board, very disciplined in their manner of funding, continued that. And so we are following best practices because we had a strong group of people that really supported that. And so also want to highlight that. What other questions do we have out there?
Julie, may I add one other point while we're waiting for another question? Since Doug Matheny is on the call, I sure want to point out that the health department had a quit line before there was a tobacco lawsuit. TSET took that helpline on as its first project because the earnings were relatively small and we needed a place to put that money that would really make a difference. And the helpline had already proven that it was a good thing, and TSET was happy to be supportive there. But Doug was working in that trench a long time before the tobacco lawsuit.
Absolutely. Absolutely. We have been very blessed with folks who have made this their life's work. And we all follow in their footsteps. I know I have learned a tremendous amount from Tracy and Doug and many others who've been doing this work a lot longer, and very thankful that they always have answers to my questions.
One other thing about Sandy's question is we're all from different counties and different parts of the state. And sometimes we get busy doing the work of TSET and forget to tell our neighbors and our friends and people we come in contact with what TSET does, or that's a TSET program, or have you looked on the TSET website for recipes or whatever. And so we can all do better at getting the word out so that our representatives in wherever we live knows that we appreciate what TSET is doing in our communities.
I've never met a community in Oklahoma that didn't have clubs or organizations. And if they've got them, they're always looking for a program. And there's nothing better than, as you said, Michelle, being able to use a local person who has some familiarity with something like TSET. So the opportunity to help educate the people around you helps then if you need to have discussion with your legislator, because you can, they may be a member of Rotary or of some other organization that you have spoken to, and they can see other community members supporting your position regarding TSET.
Thank you. It looks like our board member, Marshall Snipes, has a hand raised. Marshall, you want to unmute and go ahead? Or maybe it's my hand. Never mind, Marshall. Thank you. Marshall is a member of our board appointed by the Attorney General, and he joined our call today. So thank you, Marshall. I didn't mean to call you out with my phantom hand. We have a question in chat that says, how is TSET audited? Because we have an appointment to our board by the state auditor and inspector, we have an external audit every year. And that is Finley and Cook has done that for us over the years. That's contracted through the Board of Investors. And all of those outside audits are on our website for everyone to take a look at. We welcome that opportunity, and we welcome that high standard for scrutiny on our work. All right. Any other questions or comments? Corey Loves. Thank you, Corey. Welcome.
Hello. Can everyone hear me?
We can hear you.
All right. I just want to just have a comment just to share. And I'm from Oklahoma here, Tulsa, but I lived in the second best state in America, and that's Mississippi, for a number of years. And I was able to meet Mike Moore and work with him on some capacities, and it was pretty cool. But it hurted to see how when that money came in, how governors and legislators just went, took how we had this money earmarked, where it's going to Medicaid, it's going here, it's going there. And to hear about what was going on in Oklahoma and how they were trying to come together and protect what was coming in, it just did me so well in the South to know it did so well it made me want to come home. So I'm back home, and but it's a blessing what you guys are done 20 plus years ago, and just to be on the outside looking in, and especially in a state where some of the ball was starting to roll at an early stage, and to see how we thought way ahead of what's to come. And I would say with this, Oklahoma can rank #1 with what we did with this money, and not only for now, but for the future. So I just wanted to have a comment, and thank you guys once again, anytime I get opportunity.
Thank you, Corey. That's great perspective. All right. Any other comments or questions?
I think it's always hard to try to educate legislators on what public health really means and how they, as policymakers in the state, have an opportunity to improve health outcomes for all citizens. It's not about insurance, it's about wellness. And I think TSET has done a great job in the past in trying to help show that focus, whether it's drink more water or, some of the food nutritious type advertisements that have been run, as well as the quit smoking. So sometimes it's hard because when you run for legislator, you run as an expert on everything. You have an answer for every question. And then you get elected and all of a sudden you have zero answers for very few things. And so you have to, those of you who are experts or have some history and knowledge of health or what TSET has done and can do, constantly are having to educate large new classes of legislators to explain this is not a slush fund. This is not something that can be rated, but it is something that we can use to help your community. And so anytime you have an opportunity to be able to show what in the past has been accomplished in a region, if not in that legislator's community, I think goes a long way, because most of them have no idea of what TSET has been involved in their communities.
Yeah, great point. Great point. And I'm curious, Jerry, as you were stumping the state, building consensus for this concept, a lot of what our grantees do is educate on a policy change and then try to move, their governmental entity to pass it, because policy will outlive all of us. What kind of successful strategies did you find? Because you were really painting a vision of something that people hadn't really seen. So how did you win over people to your side?
Determination. But by the time we had a chance to do that, General Edmondson and his peers had already gotten the master settlement agreement signed. So we had something tangible to talk about, which was a great help. And then a lot of my communications were with county medical associations and the large, especially in Tulsa, the city county health department and their board and their people, the city leaders there. Was an opportunity to bring up the subject. And then the State Medical Association did a good job at that point in time in partnering and trying to motivate their local medical community to be supportive and involved, not just say, yes, we agree, but to be intentional about going out and being supportive. And that was a big help in getting legislative support at that point in time. This was not to be a partisan issue. It was an Oklahoma issue. It was a health issue. It was a long-range planning issue. And to be able to have medical expertise and those doctors and nurses and others in that field be supportive was crucial to even getting the joint resolution passed in the House, much less giving support to those statewide elected officials like Drew and Robert, who led the charge for the state question.
Yeah, very good, very good. Know who's in your corner and bring more into the corner, right?
Yeah, make a bigger corner.
Yeah. And Casey, I don't know if you would like to talk about some of those early decisions that the board had to make, because of course there was a blueprint for, how do you do this type of work? And we had some of it that was occurring with the State Department of Health. But like you said, you moved to extraordinary things as well. Can you kind of talk a little bit about what were some of the guiding principles at the time and laying that foundation?
There we go. Oh, are you, okay.
We can
I
hear
think
you.
I heard your question. Yeah, I think I heard your question, Julie, just about some of the things that we went through in the beginning and trying to plot our course. And in the very beginning, it was somewhat easy. And before I got on the board, they had decided to start the Oklahoma Tobacco Helpline. And of course, when we didn't have a lot of money, to be granting out, that was, we had to be very particular and stay a course, that went forward with that. I remember our first big one was our Community of Excellence grants, and how we were going to roll those out to the communities and the counties, and get counties to work together and build, our knowledge base and all of that went through it. And we went through some pretty difficult, intense discussions on what priorities would be. And it was always nice. There always was one board member at different times, different board members would rise up and say, but our mission is, but our priority is. So we've always remembered that tobacco was the primary cause. And as we said, though, there's many aspects in our lives.
They may have a spotty internet connection, I think. I'm still moving. Okay. Happy Zoom.
Legislature or where we were going. Did it lock up again?
We can hear you.
Just talking away. Oh, okay. All right. Yeah. That we just.
Well, it seems like the internet at our state office building has gone out. There's Jerry's back. Maybe Casey will come on back. We thought our bandwidth would support us. There you are, Casey. I'm sorry. We didn't catch the last part of that. And hopefully the internet there at the office will support.
Yeah, no, my bad. Yeah, I didn't touch anything, I promise. Yeah. So, but I just think that the board has always been very intentional about setting priorities, looking at, always had retreats where we were talking about priorities and always circling back to that mission, that constitutional language. Were we following it? Were we being true to what the public entrusted us with? And I can honestly, very proudly say that I certainly feel these first 20 years we've done that and have no reason to believe that it won't continue. But yeah, there was a lot of discussion, a lot of board talk that went through, and a lot of staff work that brought us great information that we could make that information and those decisions from an informed place.
Very good. Very good. And I don't see any other questions in chat. So if you guys have any, feel free to pop them in there. And Michelle, if you want to talk about, we've got another decade ahead of us. What do you see as emerging priorities for the board?
Well, we just had our board meeting a few hours ago, and I think one of the main priorities would be our youth, both in the vaping area as well as in the nutrition and obesity areas. If we can change that generation, we won't see the benefits for 20 years, but we can start to have a better, more healthy community. So I would say those two areas. I'm very passionate about that. And I think the other board members are also very passionate about trying to change the trajectory for our youth and in both those areas. There's so many things we could do. Even just taxing vapes at the same level we tax cigarettes at. I don't think people know that they're not taxed like cigarettes. And there's other areas that might make a significant impact early on, but.
Very good. And no, we have Marshall, and then our newest board member is Dr. Whitaker, who is from the Tulsa area, or any other board member I may have missed. If you guys have anything else that you would add, or just thumbs up to what Michelle said.
I would like to say that Dr. Whitaker is a pediatric physician, and so she brings a whole nother focus. And we really appreciate that part of Dr. Whitaker's background.
Yeah. Very good.
Thank you for that mention. This is Dr. Whitaker. I'm driving back to Tulsa right now, but I just wanted to say thank you for that introduction, and I'm happy to be a part of TSET.
Great. We're happy to have you and glad you can multitask. I don't know, Marshall, if you would add anything else?
While Marshall's thinking about it, I would like to also put in a plug for our youth program. You can get online and look at it, but we're working with different groups and clubs within Oklahoma that want to make a positive difference with youth. And so it's it's called Y'all, and youth. Remind me of what that stands for.
So
Julie.
that's the Youth Action for Health Leadership. And if somebody on staff could throw that TSET Healthy Youth Initiative into the chat, then folks can visit. Yes, y'all.
That would be great, because that's kind of one of our newer areas. And if we can educate the youth and get them on board as well as just the policymakers, I think it's going to make a big difference. And it's kind of the pilot program for us.
Very good. Thank you. And if there are no other comments or questions, I just want to extend a heartfelt thank you for everyone getting on the call. Sean, your story was very inspiring and was fantastic to connect all of us. I see a lot of grantees and board members to the why we do this, and to hear from someone with such a extraordinary story. I really appreciate you making time from your busy firefighting duties to join us and get us jazzed up and inspired. You did good work, and we're so proud of your quit. Thank you to board members. Thank you to Drew and Jerry for joining us today. And thank you to you guys for everything that you do to support TSET and the vision of a healthier Oklahoma. We know that you have a lot of community partners, and it takes folks from every sector to make a difference in our health and to continue to have those conversations with our policymakers, with our city managers, and all of those. And so please keep at it. Here we are 20 years. Imagine where we could be in the next 20 years. So with that, I will close. Thank you all for being here today. Please check out the annual report. Please take a look at some of the links in the chat, and let's keep going. Thank you, guys.